The company that knew its product was killing people. The first document arrived in a plain envelope, no return address, postmarked 3 towns away. It smelled faintly of copier toner and fear. Mara Klein slid it from the envelope at her kitchen table, the late news murmuring in the background. Inside were internal emails, hundreds of them, printed, highlighted, annotated in red pen. The subject lines alone made her pulse spike. Re-mortality signal, do not circulate. Legal exposure versus recall cost analysis. Let's not overcorrect. The product had a friendly name, SafeCore, a medical implant marketed as a life-stabilizing breakthrough. Hospitals loved it, insurance companies approved it instantly, patients trusted it because doctors did, and people were dying. Mara had been an investigative reporter long enough to recognize the shape of a cover-up. It always started the same way, a whisper, a document, someone who couldn't live with what they knew. The second envelope arrived 2 days later. This one included a flash drive and a handwritten note. They knew by year 2. They calculated the deaths. I sat in the room. The math of acceptable loss. SafeCore's internal risk committee met quarterly. The minutes from those meetings were meticulous, almost elegant. Charts tracked adverse outcomes per 10,000 units. A yellow column marked anomalies. A red column marked confirmed fatalities. By the 3rd year, the red column was no longer an outlier. It was a trend. One slide, titled Cost-Benefit Forecast, compared 2 options: voluntary recall, estimated cost $4.2 billion, brand damage, severe, stock impact, catastrophic, continued distribution with updated labeling, estimated wrongful death settlements, $480 million, non-disclosure agreements included, stock impact, minimal. A note at the bottom read, from a fiduciary standpoint, option B is the only responsible choice. Mara stared at the sentence for a long time. The word responsible felt radioactive. The whistleblower. He agreed to meet only after weeks of encrypted messages. They sat in a diner off the interstate, the kind of place that refilled your coffee before you asked. His name was Daniel Cho, former senior data analyst at the company. He said, I ran the mortality models. At first, we thought it was correlation, then causation became undeniable. Did you report it? Mara asked. He laughed once. I presented it with peer review, everything. And they thanked me for my diligence and reassigned me to market optimization. Daniel's hands shook as he stirred sugar into his cup. He said, there was a meeting, executives, legal, finance. Someone asked, how many deaths before regulators step in? Mara felt a chill. What was the answer? Daniel swallowed. More than we have. The executives. Publicly, the CEO spoke of innovation and patient outcomes. Internally, emails told a different story. We can't let emotion drive decision-making. All medical interventions carry risk. Our obligation is to shareholders. One executive warned that acknowledging the defect would set a precedent of panic. Another suggested increasing lobbying spend to slow any regulatory curiosity. They didn't call the deaths murders, they called them noise. The families. Mara met Elena Ruiz in a quiet cemetery outside Phoenix. Elena knelt beside a small headstone, tracing the letters of her husband's name. She said he trusted them. The doctor said it was safer than doing nothing. SafeCore failed inside his chest 18 months later. The company sent flowers, then lawyers. She said, they offered a settlement, but only if I agreed not to talk, not to say his name, not to ask questions. She looked up, eyes dry and furious. She said, I said no. There were dozens like her, parents, spouses, children who learned words like arrhythmia and product liability too young. Each story slightly different, the ending always the same. The story breaks. When Mara published, the response was immediate and violent. The company denied everything. Stock dipped, then stabilized. Executives appeared on morning shows, solemn and rehearsed. But regulators opened investigations. More whistleblowers came forward. A senator read parts of the article into the congressional record. Daniel disappeared from public view. Elena joined a class action lawsuit. Years later, after fines and hearings and carefully worded apologies, the company still existed, rebranded, reorganized, profitable. Safecore was quietly discontinued. What remains? On Mara's desk sits one final document that never made it into print, an internal memo written after the first confirmed deaths. We are not villains, we are simply choosing which reality we can afford. Mara keeps it because it explains everything. The product killed people, the company knew, and in the space between knowledge and action, they chose profit again and again while families counted graves and waited for justice that still hasn't fully arrived. Some stories end with accountability. This one ends with the truth and the question of whether knowing it will ever be enough.